are you doing? Good. My name is Valerie, and I'm going to be your nurse today. So I've introduced myself to my patient, and I'm going to wash my hands. Alrighty, can you tell me your name and your date of birth? And I have Kenneth Dunning, date of birth April 3rd, okay. And do you have any allergies that you know of? No. Okay. And the doctor has ordered that we put a Foley catheter in today. Have you ever had one of those? You have. Okay, so you know that it is a little bit uncomfortable, but shouldn't last too long. I do have to ask specifically, do you have any allergies to iodine, shellfish, or latex? No. If my patient were allergic to any of those, I would have to get a specific kit for that, but since he is not, I just have my regular kit. And I'm gonna get my patient prepped. So I'm gonna raise the head or the bed up to a working height so I'm not bent over top of my patient. I'm gonna remove anything that could possibly interfere with my sterile field. So jackets, stethoscopes, badges, anything like that, I'm gonna take off and place over here. Okay, and I have my sterile working space, so I need to make sure that whatever I have my catheter kit on is clean. And I'm going to tell my patient that I need to expose him for just a short amount of time here. All right, and I want to inspect the external genitalia. I want to make sure that there's no lesions, drainage, that he doesn't need any peri-care. So if he needed any type of hygiene, I would go ahead and do that now. Okay, and I'm going to ask my patient to spread his legs as far apart as he possibly can. And then I'm going to have him lay back as flat as I can possibly get him. Okay, are you comfortable there? Yes, okay. So I'm going to get my kit. All right, and with sterile kits, I always want to make sure that I open away from me first. So I'm going to go away, to the side, and to the side. And as with any sterile field, I have a 1-inch border that is not sterile that I can touch with my fingers. Okay. All right. And then in normal kits, my gloves would be right here on top, so I'm gonna grab those and put my sterile gloves on. So I'm going to open my sterile gloves. And again, I have my 1-inch border that I can touch. Okay, I'm going to perform hand hygiene before I put my gloves on. Grab the inside of the right cuff. And I want to make sure that my wrist is covered. I'm going to slide my fingers inside of the little cuff here, making sure I hold my thumb back. Okay, and again, I want to make sure that my wrist is covered and I'm now sterile. So now I'm just going to explain the steps to my patient as I do them. I'm going to start with my first sterile drape, and I need to make sure that I put the shiny side down. Gently lay that across him. And then my second drape, which has the keyhole. And I'm gonna drape that across the penis so I do still have visualization of it. And I wanna make sure that I have my sterile swab sticks, my lubricant, and my 10cc syringe. I'm gonna pull that forward there. I'm going to unsheath the catheter. And I'm going to open my lubricant, squirt it out in my tray. And I'm just going to place the tip of my catheter into the lubricant. Then I'm going to attach my 10cc syringe to the balloon port. And then now I'm ready to prep my patient. So again, I'm gonna open up my swab sticks, and my left hand, which is my non-dominant hand, is now gonna become non-sterile. So I'm going to firmly grasp the patient's shaft of his penis, and I'm going to pull up and towards the patient's head so I can see the urethra a little bit better. And with the male prep, I'm going to start at the inner circle and work my way out. So I'm going to go directly around the urethra and a little bit further out. And then one last time all the way around. Okay, so now that he is prepped, I'm going to ask my patient to take a really good deep breath in and blow out. And I'm going to insert directly into the urethral meatus. I'm going to insert until I see urine flash back, which I do. At that point, I would insert another 2 to 3 inches. I'm going to start inflating the balloon, and I'm going to ask my patient to tell me if there's any discomfort while I do that. He does not have any discomfort. I fully inflated my balloon. I'm going to lightly pull back and tug just a little bit to make sure that balloon is sitting at the opening of the urethra and the bladder. And at this point, I'm no longer sterile. So what I'm going to do is get my stat lock, and I'm going to apply it to the inner portion of the thigh here and attach my catheter to the thigh. And then I'm going to take the bag of my Foley catheter and place it on an immovable part of the bed. It should have some loops down here. Okay, and are you feeling okay? Still comfortable for the most part? Yes, okay. So at this point, I'm going to clean up my mess. Get my patient back into a comfortable position. So you can move your legs back together and get you covered up. Okay, I'll set the head of bed back up if he wants me to. Now, before I leave the room, is there anything else that I can get for you for right now? No, so I've made sure that all of my patient's needs are met, and that the room is neat and tidy, so I've disposed of my trash. I'm going to put the bed in the lowest position and make sure that it is locked. Okay, and now that he has the Foley catheter, he is going to be a fall risk, so I'm going to put his bed alarm on. He has 2 side rails up, no more than 3, because that is a restraint. I'm going to make sure that he has the call light and can call me if needed. Since he is a fall risk, I'm going to leave the door open, and then I'm going to wash my hands before I leave the room.